An unprecedented pandemic, COVID-19, has engulfed the world. COVID-19 is caused by a novel coronavirus. Healthcare workers involved in the treatment of COVID-19 patients are more susceptible to get infected. A strict protocol has to be followed by all the stakeholders. In this war against COVID-19, where the larger focus is on saving lives, managing biomedical waste is critical. Unscientific management of biomedical waste poses a grave danger not only to humans but to the environment at large. The Central Pollution Control Board, CPCB, has issued guidelines in accordance with the Biomedical Waste Management Rules 2016. There are 4 color-coded bins into which biomedical waste is segregated. This should be done at one point where waste is generated. Yellow and red coded bins have color-coded bags. The bins have the COVID-19 labels. Non-chlorinated plastic bags of not less than 50 microns with biohazard symbols must be used. As a precaution, double-layered bags are used for collection of waste to ensure adequate strength and no leaks. Infectious waste like tissues, cotton, dressings contaminated with blood and body fluids, swabs taken from patients and suspects must be discarded in the yellow bin. Used blood bags must be autoclaved in autoclave-safe bags or microwaves and discarded in the yellow bin. All used masks, including triple-layer masks, N95 masks, head cover cap, shoe cover, disposable linen gown, non-plastic or semi-plastic coverall must be discarded in the yellow bin. All used PPEs such as goggles, face shield, splash-proof apron, plastic coverall, hazmat suit, nitrile gloves into the red bag. Tubings, syringes without needles, catheters and IV bottles and any other recyclable material must be discarded in the red bin. Viral transport media, plastic vials, vacutainers, Eppendorf tubes, plastic cryo vials, pipette tips, used testing kits must be autoclaved in autoclave-safe bags or microwave or chemically treated as per BMWM rules 2016 are collected in red bags. Sharps waste like different types of needles or any metallic sharp waste must be discarded in the white container. Glassware and metallic implants must be discarded in the blue bin. On-site decontamination of waste collected in blue and white containers using 1% sodium hypochlorite is preferred. Collected waste in different bins must be handled systematically. The inner and outer surface of containers, bins or trolleys used for storage of COVID-19 waste should be disinfected using 1% sodium hypochlorite. Collect and store biomedical waste separately prior to handing over the same to CBWTF. Use a dedicated bin labeled COVID-19 waste. Use dedicated trolleys and collection bins in COVID-19 isolation wards with the label COVID-19 waste pasted. Keep the waste separately in temporary storage room or hand it over directly to CBWTF from COVID wards. Management of wastewater from healthcare facilities and isolation wards. Disinfection of treated wastewater to be undertaken as per prevailing practices. Operators of ETPs or STPs to practice basic hygiene and use appropriate PPEs. During COVID-19, HCFs may avoid using treated wastewater. Biomedical waste generated from quarantine centers should be collected separately in yellow-colored bags provided by urban local bodies. Place them in appropriate separate bins. It is preferred the waste be directly transported to CBWTF. CBWTFs must report to the State Pollution Control Board about receiving COVID-19 waste. Operator of CBWTF should ensure regular sanitization of workers involved in handling and collection of biomedical waste. Workers should be provided with adequate PPEs, including the N95 mask, splash-proof aprons, heavy-duty gloves, gumboots, and safety goggles while disposing of the infected waste. A dedicated vehicle must be used to collect COVID-19 waste. It is not necessary to stick a COVID-19 label on such vehicles. Vehicles must be sanitized with sodium hypochlorite after every trip. The operator and the hospitals treating COVID-19 patients must maintain a separate record of the movement of COVID-19 waste. In case there is no access to CBWTF, infectious waste should go into the deep burial pit. All healthcare professionals and workers coming in contact with COVID-19 patients or those handling waste generated during their care must wear PPEs. This is how a PPE should be donned. Remove all jewelry like rings and bangles or any other accessories. Wash hands thoroughly according to the procedure mentioned. Wear the head cover. Be seated and wear the shoe covers. Use hand rub to sanitize hands. Wear the inner hand gloves. Wear the gown. Followed by mask, goggles, hood, and finally the outer gloves. Hand rub to sanitize hands after donning every piece of equipment. Following care of the patient, the PPE needs to be removed in a separate doffing area with access to running water for washing hands thoroughly in the end and appropriate disposable bins. Remove the gear in the prescribed manner, slowly, taking care that the exposed side of the gear is away from the body. Remove outer gloves by rolling them down towards the fingers and crumpling it into a ball and dispose it in the red bin. Remove hood without touching the outer infected surface and dispose it in the yellow bin. Untie the gown. Roll it in such a way that the infected outer part gets rolled inwards. And dispose it in the yellow bin. Sit down on a chair and remove shoe cover. Dispose it in the yellow bin. Use hand rub to sanitize gloved hands. Remove goggles and put it in the red bin. Remove mask and cap and put them in the yellow bin. Disinfect shoes. Remove inner glove and put it in the red bin. It is important to perform hand hygiene after every step during doffing of PPE. Finally, wash hands thoroughly. Ensuring environmental hygiene of healthcare settings is equally important for safe workplaces. Fever clinics screen potential COVID-19 patients across the country. Safe methods of disposing waste and protecting oneself in the front line will surely go a long way in winning the battle against the deadly COVID-19.